So, if you've ever wondered what studying medicine in Australia is truly like, because I'm the most trustworthy source out there, then stay tuned as I'm going to explain and review my first year of medicine. Picture this. You join your meeting for your case-based learning class, essentially where you meet up with your group to analyze the presentation and sickness of a particular patient. Instead of being able to fruitfully join the conversation, the physiology and anatomy leave you entirely confused. The guy with chest pain who has atherosclerosis apparently has a normal eye or sclera. It turns out learning chemistry for 3 years in undergrad didn't really set me up that much for medicine. But did that really matter? Well, before I answer that question, let me introduce myself a little bit. So if you're new here, my name's Abdullah. I'm a first year medical student at Uni Melb, or I was finished. We'll see. Let me pass my exams, but whatever. And I did a 3 years undergraduate in Melbourne Uni as well, in a Bachelor's of Science, majoring in chemistry. Now, some other stuff I like to do, I like to ride a motorcycle, like to drive a nice car, like to work on them a little bit, tinker a little bit. I also do some random stuff as well. So if you later want to check out those videos, you can as well. Anyway, let's get into how I found my first year. So specifically at the uni that I studied at, this is kind of the structure. Initially, you've got 5 weeks of foundations where they kind of try their best to bring you up to speed in terms of basic biology or basic sort of chemistry and all the basics that you need. And then they separate the rest of the year in blocks, such as a cardio block, GI block, a rest block, and so on and so forth. They vary in length. Some of them are 3 weeks or 2 weeks. Some of them are 5 weeks and kind of get lengthy. The thing is, though, every week you have anywhere between like 5 hours to 9 hours worth of lectures, and it kind of gets a lot. But on top of those lectures, you also have classes. And there's 3 types of classes mainly. You've got your clinical skills class, where essentially you learn any clinical skills that are relevant for your upcoming years, such as taking a patient history or doing an examination. Those are the 2 main things. And later on, I think we learn like small minor procedures like cannulations and stuff like that. So that's one type of class. Another type of class is a case-based learning class, what we call CSL. People may call it PBL. Essentially, every week you get a case based on what block you are, and you with your group have to kind of come up, okay, why have they come in this way? What's happening with them? Let's try and explain it in the background information with the anatomy, pathophysiology, and link up all the dots that we need to. It's a really fun class, and that's where you actually get most of your learning from. And then at the end of the week, you present it and you as a class kind of discuss it. A third type of class is just a professional practice class. Essentially, you learn about ethics and how to become a good doctor and like how teamwork is important, communication is important, which is great. And don't get me wrong, it's an important class, but at the same time, it is a bit of a 1 hour like yap sesh every week. We also have an elective that runs for 10 weeks somewhere in the year. That's just kind of like whatever you want to do. My elective was death and dying. We kind of explore different aspects of palliative care and end of life care. So that's kind of the general structure. And if I had to put in like a weekly timetable like this is kind of how it looks like. So there actually isn't a lot of contact hours. You only go to class for like the 1 or 2 hours you need for that day for that class. Lectures are all recorded online. You don't have to do them. I didn't do them. I'll get into that later. In terms of content versus undergrad and postgrad, while there's a lot more, especially with the lectures, there's a lot of detail. Here's the main thing that you need to realize early on. They give you this analogy that medicine's like trying to drink water out of like a fire hydrant, and here's a really funny image. It's important to realize that yes, you have a lot of information, a lot of resources, but compared to undergraduate, you're trying to maximize your marks, you're trying to maximize your GPA, trying to be the perfectionist. You can't do that here, because if you do that, you will spend every waking moment trying to study, where you really just need to be okay with doing like 60-70% and just passing. Not that that's a bad thing, but quite literally, if you try to take that extra effort to maximize everything, perfect everything, you're going to burn yourself out, you're going to have a terrible time, and you're going to have no social life. And that's kind of what I'll kind of delve into later on, is how is the life learning medicine. So let me tell you what I did essentially. After about the 5 weeks of kind of realizing that there's a lot of lectures, if I do every single one of them and if I take notes, I never take notes, but if I theoretically took notes, It would be spending like good 3 hours every single day just kind of going through all the content, and then at the end trying to remember everything, and then on top of that with the other classes, and it would be too much. So what I did, and this is kind of how I studied, is I took a break from the lectures just to see how it was, and then I never went back to it again. But when I went to cardio block, for example, what I did is I got all the learning outcomes. Okay, so every week they tell us, here's what you should know, these are the objectives. Put them in ChatGPT and summarize them, blah, blah, blah. But essentially, I learned what I needed to from somewhere else. For instance, I use Osmosis. Osmosis is a really good website if you don't know. It has very like bite-sized content, about 10, 15 minutes of a video explaining a concept. So that was my first step, is learning the big concepts. Okay, how does like atherosclerosis actually work? Like what is the plaque formation? How does it lead to perhaps a heart attack? And then you learn about arrhythmias and different arrhythmias and how to differentiate between them. That's another video. And so each video is its own topic, and you just kind of learn the broad topics. Once I did that, then it came down to memorizing any specific information I needed. Okay, this drug, this. What is beta blocker? How does it work? And why is it used? Anything I needed to specifically memorize, I'd use Anki. Right? Great flashcard resource just to memorize the key things you need to memorize. And that's how studying should be. Is generally in medicine, you've got these broad topics, and what you say are sort of scaffolds. They kind of form your framework of how do you understand this block? How do you understand this sickness or this group of sicknesses? For instance, respiratory block. How do you understand like respiratory infections? For me, I've realized that you remember the broad concepts because you understand them. You don't just memorize concepts. You understand concepts and then you happen to memorize them later. Then what happens is any specific information you need, you can separately memorize that. And because you understand the concepts, you know how that specific information is going to fit there. So really, understanding everything was the key to remember everything. And so that's kind of how I studied. So if I had to put like a weekly sort of timeline on how I did it, so Monday I would take all the learning objectives for that week, sort them out, and perhaps spend 2 to 3 hours just learning the broad concepts. Tuesday I had a clinical skills class, so before then I would probably read up, learn the clinical skills during the class. I'd also have professional practice during that day, which is the PP class. Just chill and talk about ethics and communication and teamwork for a little bit. I'd come home and I would rewatch or perhaps watch more of those content videos. Wednesday was a bit of a free day. I would catch up on any content I need to, but mostly I'd finish it, and then I'd start remembering things. Thursday is usually hospital day or a GP day, and I'll talk about that in a second. And Friday is that sort of meeting with that case-based learning, where you come back, talk about the diagnosis, and just kind of discuss the pathophys behind it and any management or treatment, and just general questions about, okay, we learned about pneumonia this week. Any questions from how it starts to how it ends and everything in between. And so that's kind of my typical work week. When it comes to sort of social life and work-life balance, I found that literally not doing the lectures was the biggest time saver. Because the short 10-minute videos that I mentioned, they'd be mentioned in the lecture, but over the course of 1 hour. So you save like 50 minutes most of the time just by watching those bite-sized videos. Of course, you miss a lot of specific information, that niche information in the lectures. And of course, there's benefit to them. But I think if you're trying to compare high yield versus time, lectures are not it, personally speaking. Because of the way I structured my study, I had a lot of time to do a bunch of stuff. That is ride my bike, kind of exercise, do religious studies, and just kind of hang out with friends. So to kind of overall summarize this sort of aspect, it was a bit rambly, but essentially medicine is really fun to study. It's the first time I'm mentioning that, actually. It's not a summary, but it's really fun to study because I made it fun by not overworking myself. There's a huge potential to just be drowned out in work and content and resources, but by managing it yourself, and this is kind of like the tips that I mentioned earlier, and managing yourself and learning it from broad concepts first, everything just sort of fell into place. Now let's kind of delve into clinical exposure a little bit. So after the 5th week, on Thursdays, you have your placement day. Of the 4 weeks in a month-ish, 2 of the weeks would be GP placement. 1 week would be kind of a free week, so you wouldn't have anything on that Thursday. And that 4th week would be a hospital placement, where you get assigned to a hospital and you kind of go there and expose yourself clinically there. Let me talk about GP placement. Everyone's kind of experience varies depending on which placement you get, which GP you get, and how well the GP understands what you need to know as a medical student. Thankfully, I was at a very good GP placement who's been doing the GP Student Association program for many years with the uni. And they kind of knew what we were studying and they knew kind of how to teach. So how it worked for me, for the first 2 weeks, I'll just sit in with the GP, kind of just experience, be a little bit of a pop band at the back. After the kind of first 2-3 weeks, the GP then told me, okay, I'm going to be taking this patient. You can take the next patient into a separate room, have a conversation with them, practice your history taking skills, ask them any questions that you need to, that you'd feel as like a GP, you'd ask the patient. Practice everything you've learned sort of in your clinical skills class about taking history. Once you've done that, you can come with that patient back into the doctor's room and the doctor will kind of do the same thing. And then afterwards, once the patient leaves, the doctor kind of asks me questions about, okay, what do you think about this presentation? What do you think about this? What's the significance of the sore leg? What's the significance of the fever? And they kind of quiz you and they kind of assess your knowledge. In between them, if any examinations were needed, such as, okay, look into the ear, or perhaps can you take a blood pressure or listen to the chest, the doctor would say, okay, you can come and do it. That's kind of how my GP placement ran. I did think that was a great experience to practice what we've learned in the clinical skills class, which is examinations and history. To practice that once upon a was really helpful to kind of integrate that knowledge and solidify that knowledge. That being said, after about 2 months of doing that, it becomes very repetitive because most of the time, the patients that come have perhaps like a sore throat, runny nose, chest infection, or they're just coming for the results. And if I take a patient in to the consulting room and ask them, why'd you come in today? And they're like, oh, I just after my results. I'm like, okay, cool. There's not much I can do. Of course, you can practice other aspects like, okay, why did you take the test? And then they can go back into the past history. They said, oh, I was feeling a bit tired. I'm not sure how my iron levels are or my vitamin D is. And so that's why the doctor recommended to me and I'm doing the test. But then eventually it comes to a point there's only so much far back you can go and there's not much significance there. And when a lot of the times it's kind of repetitive, you've kind of learned what you need to after the first 2 weeks. And then for the remainder of the GP placement, 80% of the time was things I've seen, which is kind of good to kind of solidify your knowledge. But it came to the point where I was thinking I could use this time to study and it would be a bit more beneficial. So that was kind of the main issue with GP placement. Now, of course, it's kind of what you get out of it. Yes, there's going to be times where you're not going to be doing nothing. But even then, while you're not doing much, making that opportunity to still ask the GP questions that, okay, what about this diagnosis? Or perhaps confirming a pathophysiology. And just kind of really solidifying knowledge and trying your best to learn, even though you've learned what you needed to, it kind of did sort of help. So that's kind of my overall sort of impression of GP placement. Yes, it was really good initially, and it still continued to be good. Don't get me wrong, especially towards the end of the year, there were some patients where I'm like, oh, this is a really complex patient. It's going to be very good practice for me to talk with them. But 20 to 30%, or maybe 4 or 5 patients, you had a good opportunity to learn, which overall is still pretty good. And I'd say that if I had to take GP placements, or I have no GP placements, I would definitely take GP placements. To summarize my kind of impression, they were good. Just make sure that when you go there, you take the moment to learn what you need to and really perhaps quiz yourself, because it's what you make out of it that you'll get out of it. Now, talking about hospitals, we only had 6 hospital placements this year, and most of the time they followed the blocks. So after the cardio block, you'd go to the hospital and kind of do a cardiology-based sort of learning. How it really was is 1 to 2 hours in the morning, we'd go to a clinical skills class. They would have a small lecture talking about, okay, well, this is the cardio block, so I'm going to talk to you about perhaps ECGs. So they have a mannequin. This is how you set up an ECG. This is how you would do on a patient. These are the red flags, blah, 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 blah. And then later on in the day, they'd say, okay, here's another sort of random procedural skill. You're going to learn how to put an injection, or you're going to learn how to measure blood glucose. You're going to learn how to read urine charts, which is cool. It is fun. It is different from normal. Yes, 2 hours learning about the color of your poop, it's a little bit much. Like in the GI block, I remember it was just a 1.5 to 2 hour sort of explanation of how the different colors and how the different shapes of the pool, what they mean. Of course, like after 20, 30 minutes, you can understand and like, okay, I got the idea. We can kind of move on a little bit. After those first classes or two in the hospital days, we then were taken out to the actual hospital by MD4s and seniors, and we were able to talk to patients. We're able to perform the examinations we learned, like the full cardiology exam or the full sort of RESP exam or the GI exam. We were then gone to people who are struggling with these issues, and you'd find findings, right? Of course, they'd consent to it, and they'd not be completely uncomfortable. And you'd either practice a history, you'd practice an exam, and there were some really key and memorable moments for me. For instance, in the neuro block, we had a chance to interview a patient. One of the main topics you learn in neurology is stroke. Now, when you talk to people who've had a stroke, most of the time they don't recover. And so it can be hard to speak to them because when it affects your speaking or perhaps in the brain, if it affects your Broca's and Wernicke's, then speaking can be an issue. But we met this really cool patient who had a vertebral artery dissection. And because of the pressure from the bleeding, it kind of mimicked the symptoms of a stroke. And so once it was repaired, neurologically, they were fine. The great thing about that is you were able to take a stroke-like history. Ask them, okay, how did you feel? Was your face, which side of your face was drooping? Did you feel numbness in your arm and leg? Did you have trouble walking? All of these things that could be related to a stroke history could be applied with that vertebral artery dissection. Because he was a 40-year-old man. He was really young. He was really chill. And it was great to talk to him because sometimes when you talk to patients with traumatic events, when you take a history from them, you can tell that, they don't mind talking, but it's still hard for them to talk. In their hearts, it is a bit distressing for them to recount a traumatic event. And so this particular opportunity was very, very cool because he seemed very chill and he knew that we're medical students and he's not going to give the full picture. He's going to really test us. And so that patient was really awesome and stellar. And so there were great moments like that intermittently with the hospital. And so overall, I really enjoyed my hospital placements. They were the days I looked forward to whenever I knew, we've got hospital this week. I can't wait because I'm going to make the most out of it. Now, next year, I'll be hospital 4 or 5 days a week. And so it may get a little bit of a drag here and there, but we'll see. Let's kind of move on to, say, the emotional state. How did I feel entering med school? Now, a lot of people have what we call imposter syndrome, especially when you've been the top of your undergraduate, you've had like maximum GPA, you've done really well on like a medical entrance exam like the GAMS had. And the second perhaps you come into medical school, everyone's like that. And so now all of a sudden you're middle of the pack. You feel like perhaps you don't belong. You feel like, did I accidentally fluke? Was there an issue with administration? Am I really cut out for med school? This is what we kind of call imposter syndrome. And no doubt everybody has experienced a form of it. Now, for me, myself, during med school, I personally didn't really feel imposter syndrome. Now, I know that sounds arrogant, like, oh, I knew I was meant to be there. I didn't feel imposter syndrome, but it's not like that. It's a bit different. Because I sort of had this experience back in high school. I was thankful enough to go to kind of a selected entry high school, which is like, you need to take an exam to get in. And it's like very top few percent go in. And again, not to brag, but the idea was I felt the same. When I got in, everyone around me was telling me I fluked into this selective entry school and that I'm going to struggle in there. And honestly, I did. When I went there for the first couple of months, I knew, I could feel 100% objectively that these guys were way smarter than me. These guys knew what they were doing. These guys were on the ball intellectually. It wasn't imposter syndrome because I felt okay with that. I felt that, okay, these guys are better than me. And then I felt the drive to work towards it. I felt the drive to be like them. It's not exactly imposter syndrome because imposter syndrome is more so that you know that you should be here and you do deserve to be in here, but you don't feel like it. I kind of knew the opposite that, perhaps these guys are way smarter than me. That's kind of objectively true, but I feel okay with that and I'm going to strive to be like them. That's kind of how I felt with med school a little bit. When I went in, perhaps I did feel like, okay, I have some merit being here. And I know that these are my strengths. For instance, I know for me, my memory is a good strength of mine, thankfully. But perhaps in other areas, I'm not that great. I'm not great at writing. I'm not great perhaps in my communication and articulation. I saw many people who had great communication skills, great articulation, the way they were able to deliver concepts in a concise manner, it was incredible. And it wasn't, I felt like, oh, now I don't belong. I felt like this is what I'm lacking in. I'm going to take this opportunity to improve. Now, I know this is not what I'm saying that the cure to imposter syndrome is try and make it better and try and use this opportunity to improve. I'm just throwing my experience out there that I know sometimes you just have to realize your own merit. You need to realize that even if you are down in the depths, that's okay, right? You don't get into med school knowing everything in medicine. You get to med school to learn everything in medicine. And that goes back to my earlier analogy that I mentioned, that yes, I took chemistry as an undergraduate. I came in knowing nothing. Most of the people here did a biomedicine degree. They had a decent foundation of anatomy and physiology. But the reason why they weren't prerequisites for medicine is because you get taught everything you need to. By the end of the year, you'll basically be at a level playing field with everybody else. And I knew many people who did like film majors, economics, law, and they're all fine. So don't worry about it. Trust in the process. Trust that you got here somehow. You got to medicine because you had habits. Whether they were 100% the best study habits or whether they were 70% pretty good, yes, inefficient here. And that's how it is mostly. Even I have mostly good study habits. There's a lot of inefficiencies here and there. But just because you may not be the most efficient, that doesn't mean you won't get the work done and you won't learn what you need to. Trust in the process. If you feel like you don't belong, I know it's hard to just say, oh, get over it, but trust that you've gotten here some way, and that's because you had these methods, you had this habit, you've had everything you built up. Even if you feel like you're not doing that to the same extent as you were an undergraduate, you felt like, oh, I'm still at 70% of capacity or what it used to be, trust that it will be enough. And of course, if you feel like it's still not getting you there was a lot of academic help and support. And from friends and other people who mentioned they did talk to a lot of the staff and tutors, they felt that it was very helpful. One aspect I want to talk about is the teachers and the actual learning and my enjoyment. I can't stress enough that for some people, medicine isn't the answer. Don't do medicine if you don't have the passion for it. But I truly sort of feel that because there is a lot more content compared to my undergraduate and a lot more things to understand, but I genuinely just enjoyed everything. On the Mondays and Tuesdays when I knew I had to sit through a bunch of concepts and learn everything, I didn't feel, oh, I can't be bothered doing it. I felt like, oh, I can't wait to delve into this. It was the excitement, the passion. I think that if you don't have that, you're doing medicine because of the money, you're doing medicine because of what other external influence, you will not get far. Generally, you will either drop out or you'll push through and you'll hate yourself. Passion is definitely needed because it's the one thing you keep coming back to. Like there's going to be times where like, oh, why am I even studying this? Or I can't be bothered doing this. But then you get back into it and you realize, wow, like this is really, really interesting. I dreaded neuro at the start of the year. Neuro was at the end of the year and I was just waiting for it. It was 5 weeks and I knew nothing about the brain. I didn't even know the name of the 4 sort of lobes. And I went there knowing nothing, dreading it because if you look at the anatomy of the brain looks the same all over. The heart looks different. The lung looks different. You can tell, okay, this is this ventricle, this is the right atrium. You could tell. The brain just looks like the brain. It's hard to tell where everything is, and so I was dreading it. But once I went in and I started learning about like the spinal tracts, I started learning about all the different areas of the brain and the aphasias. I learned about stroke. I learned about lesions and how they affect the spinal tracts. I was like, whoa, this is great, right? I actually enjoyed neuro one of the most. I think the most actually, compared to say, I think cardio was up there, neuro was up there, GI was up there. I enjoyed everything. There was things that, okay, I didn't like as much, but on a scale of 1 to 10 of enjoyment, everything was at least a 6.57. I'll tell you that genuinely, if you know that you may struggle with the workload, but you do know you enjoy medicine, you'll be fine with the workload because you won't get burnt out and you won't lose energy as easily when you do something you enjoy. That's kind of the nature of it. Do you need a science background? It helps. It helps expedite the process. I would say that you may struggle within the first 2 months if you don't have a science background coming in. Even though I did a chemistry major, I still didn't know like anatomy, physiology. I did read a little bit about before I started medicine, but I was still behind for the first 1-2 months. As long as you're comfortable with that and trust that everything will come naturally. Because when they talk like about the heart 5 times every single hour, when they're talking about a heart attack or they're talking about arrhythmias, and they talk or mention the same thing over and over and over again, you'll eventually remember it. That's just how it is. Repetition, you'll eventually remember just by osmosis. These are the 4 heart chambers. These are all the valves. This is how pumping goes. This is the order of oxygenation, just because you just went through that so many times. And so even if you don't have a science background, you remember it. Can you still have a life outside med school? That's up to you again. Literally, if you don't spend 8 hours, 9 hours a week doing lectures and an extra 5 hours writing notes for that, an extra 5 hours memorizing the Yankee cards, if you don't do that, yes, you'll have a life. Can you pass without doing that? Yes. I've been doing that, thankfully. A lot of people I know, I've been doing that. Will you get 90% doing that? No. You'll get like 70% or maybe 60%, but you'll pass. Well, another big tip is do study groups. I was never a fan of study groups in undergraduate. In undergraduate, when you're trying to memorize every single thing to 100%, it is just rote memory. You're cramming it in. You don't need someone else really. You just sit at home, look at an Anki screen, and just do it. When it's medicine, and most of your understanding of medicine comes from knowing the concepts, this is when study groups are very beneficial because you're just talking to people. You're just bouncing off ideas. How does this work? How does this work? What is this one process going to the other process? I remember the best sort of revision I've had is sitting with one of my friends, and we're just 6 hours in call, just talking about all of the blocks that we went through. I think that day we went through like neuro, repro, cardio, resp, like 4 of them. I don't know. We just sat down and we went through like slides, and they were like, okay, let's talk about heart attack, or let's talk about asthma, let's talk about stroke, let's talk about this, let's talk about that. And we just talked about it. Talked about, okay, what's the most common areas of stroke? What are the different types of stroke? What about head injuries or like brain bleeds? There are different types of bleeds. How do we differentiate on them? On CT, on MRI? How does the management change? How is the presentation? Just talking through it. Because they forget something and you remember it. You forget something, they remember it. And you're just bouncing ideas. You're just having a big conversation and chat. And the good thing about it doesn't feel like you're studying a little bit. Like it feels chill that, oh, we're just talking through it, but you're actually doing a lot. You're bouncing ideas, you're remembering things, and you're understanding things together. Study groups is very, very important, I think. I was never a fan of them. Trust me, I never liked them in undergraduate. I felt like they were useless. In medicine, I think they're really, really helpful. Overall, I think I really enjoyed this year. Very thankful to have gotten into medicine, alhamdulillah. And I really think if you're going to start medicine next year or very soon, you will enjoy it as long as you don't overwork yourself and try to learn everything. And if you're trying to get into medicine, take this as a notice that, look, once you get there, the grass is greener on the other side, that it is enjoyable. I've thoroughly enjoyed it. Of course, that's not everyone's experience. People may come in and tell you that this is not what I expected. But if you're struggling right now as a pre-med, you don't know if it's going to be worth it. In my experience, medicine is really fun. First year was really fun. And they say that first year is the worst because you're not doing any clinical stuff. You're just at uni learning everything. And that all the clinical stuff is fun, way funner. And for me, the fact that even if this is not the funnest year, I still had a decent, enjoyable time, it looks good for the next coming years. So keep up, keep striving. You'll get there, hopefully. I'm looking forward to MD2. I know I haven't uploaded in a little bit, my bad, guys. How always happens. But MD2 will start in the next 2 months or so. I'll be uploading my vlog about how it is like to go to hospital and what I do there in my second year of medicine. That's how it is. If you have any guys have any questions, let me know. Like and subscribe, all that jazz, whatever it is. This is my review. I tried to make it as structured as possible. I don't think it was very structured. I realized that at the end. So my bad, guys. But we'll see how it turns out. Either way, thank you. And I'll see you guys next time.